So hello and welcome everybody. Thank you so much for joining us today. We wanted to take this opportunity to fill you in on how Healthy365 started, what we've been doing, and our plans for the future. So I'd like to start off by introducing myself, and then each of our team members will introduce themselves to you so that way you can put a face with a name. If you're new to Healthy365, maybe you haven't met all of us yet. So you will hear from all of us today just to keep it interesting, except for Laura Baker, who is out of office today. So we are sad not to have her be part of this today. But Laura is our Congregational Network Navigator. My name is Amanda Hinkle, and I'm the Healthy365 Healthy Community Manager and the System of Care Coordinator for Hancock County.
I am multitasking and trying to do my best to keep up with everything. And I'm Amanda Everidge, the Director of Community Health Improvement and your PowerPoint guru today. So bear with me if there are any issues with that. I apologize in advance.
Hi, I'm Brandy Baston, and I am the Tobacco Free Coordinator and also coordinator of the Hancock County Tobacco Free Coalition.
Hi, I'm Jessica Abraham. I am a support navigator and a certified recovery coach for Healthy365.
I'm Terry Gottschalk, and I am the newest support navigator.
And I am Christy Montgomery, the Healthy365 assistant.
And Christy's going to kick us off talking about Hancock Health's mission and vision.
Hancock Health's mission and vision are truly the heart of Healthy365 and our staff. I'd like to share those with you today. Our mission is to be a caring community partner by healing, improving health and wellness, alleviating suffering, and delivering acts of kindness, one patient at a time. The vision for Hancock Health is to be nationally recognized for kindness in the delivery of excellent quality patient care, efficient and effective operations, the adoption of proven technologies, the creation of positive workplace environment, and excellence in community service. As you can see, both statements share one word in common: kindness. We work to ensure that kindness is felt throughout our organization and our community. While Healthy365 has a mission unique to the department, we put this mission and vision at the heart of all that we do here as well. A team of associates came together and created the Love Promise and coined the phrase, living our values every day. The Love Promise is a living document that is reviewed and signed by every associate within Hancock Health. It is our promise to uphold our core values through every interaction. We promise to be uniquely strong and ensure in providing excellent, innovative care, to serve all with integrity, accountability, and respect. We are committed to our organization, our professions, and the well-being of others. As we promise to be consistently trustworthy, dependable, and genuinely care about you. Each of us here at Healthy365 has signed the Love Promise, and it is our hope that you have noticed this interaction with us throughout our organization.
As a health system, we're always working to find opportunities to optimize our system's performance and follow best practice models for improvement. The Institute for Healthcare Improvement refers to the following framework as the AAA. Health systems across the nation work on improvement in these three dimensions in various ways. Hancock Health is committed to providing high quality, innovative care at the lowest possible cost and to address the health status of our community. The population health strategy looks to identify opportunities to impact the health status of individuals and communities. Only 20% of an individual's health status is significantly impacted by healthcare directly, forcing health systems to look beyond the walls of the hospital to have a meaningful impact on the community. As you can see, 40% of overall health is related to socioeconomic situations, which include education, employment, family and social support, income, and community safety. 10% is directly related to physical environment, and 30% is related to health behaviors, meaning what you put into your body and how you take care of it. Social determinants of health are the conditions in the environment where people live, learn, work, play, and pray that affect their overall health, functioning, and quality of life outcomes. You've heard us say this many times before, your health status is more dependent upon your zip code than your genetic code. You may remember in 2015, we hosted a presentation about blue zones. What has been learned about the blue zones is that the choices we make are directly related to the choices we have. People in these blue zones experience better quality of life and often live to be 100, more often than any other location in the world. The understanding was the culture within these locations had built infrastructure to promote healthy choices and connect individuals physically, emotionally, and spiritually. Hancock Health took the first steps toward impacting the culture of wellness for Hancock County by creating a community-centered approach to addressing health needs. Healthy365 was founded in 2015, and the collaborative effort to build our own Blue Zone print started. It was important to identify and develop key partnerships with leaders that could help provide guidance and direction in beginning such an initiative. With the support of the Mayo Clinic and the Wellness Council of Indiana, guidance tools were provided to assist in identifying opportunities for collaboration throughout our community with focus on all areas of health. Healthy365 became a fast-paced initiative where mission is to promote health, happiness, and wholeness in Hancock County. The first accomplishment from combined efforts was obtaining a 3-year Indiana Healthy Community designation in 2016, with a redesignation for 19 for continued efforts toward community improvement.
Healthy365 would not be possible without our community partnerships, which is many of you on this meeting today. We have grouped everyone together by category because to provide a comprehensive list of each agency and each individual that is involved with Healthy365 and a part of our teams would literally be hundreds of people. So thank you for all of you for taking part in our journey over the last 4.5 years. Many of you have been around since the very beginning and have put a large footprint on Healthy365. It's exciting to continually have new partners join. I think every meeting, every month, there's always a new face. The great thing is that not only are we building relationships with our partners, but our partners are building relationships with each other, which is what impacts how well we can all help those in need. Healthy365 started by forming teams. Our teams have morphed over the years. Some partners are involved in just one single team, and some are involved in many or all of the teams. These teams are voluntary and anyone can join. It really does take a village to accomplish our mission and vision. With 29 church partners, the Congregational Network provides faith-based support to give an extra layer of love to be sure people get the support that they need in the hospital and at home by connecting people to resources and a faith community. The goal of the team is to help people be the healthiest they can be by removing barriers and assuring all areas of their health are supported, including social, physical, emotional, and spiritual. This includes support that may look like navigation, prayer, a meal, or just a simple visit. The network offers education classes and support groups at the churches on many health topics that can help congregations lead a healthier life. If you are part of a church and would like to see if they are partnered with Hancock Health and you would like to become a member of the network, you can reach out to Laura Baker. Healthier Choices focuses on how to make healthy choices the easier choices. While this team does not still meet on a regular basis, the work definitely continues. The programs have morphed over time and various community partners have taken on the facilitator role. Healthy365 remains actively engaged with these groups and supports their efforts at improving. System of Care is our largest team and focuses on improving mental health and substance use treatment services for youth and families. The team is a representation of many of the groups listed on the previous slide and many of you who are on today, from early childhood, the faith system, justice, to senior services, and so many more. We look at what services we have available, if there are ways that we can improve them, what barriers are preventing people to access them, and what services we are missing. The group is about networking and ensuring all organizations are aware of what resources are out there. We meet monthly and every meeting looks different. There is also a youth and family component of the System of Care, which we strive to seek out lived experience to help us improve and better meet what families are truly needing. For more information on this team, you can reach out to me directly. The Tobacco Free Coalition's primary function is to provide education, treatment services, and impact public policy to encourage nicotine-free living. This team is often out in the community providing education in schools, reaching thousands of youth, going from businesses to businesses, ensuring they have smoking and vaping free signs posted, and checking to see if retailers who sell tobacco products are following appropriate advertising, just to name a few of the many things that this team does. This team also meets monthly, and for more information on this team, you can contact Brandy Baston. Our last team is Workplace Wellness, and Workplace Wellness promotes healthy living incentives within our workplace environments. The businesses that are part of this team share their employee wellness plans and incentives with each other. We meet quarterly and often have guest speakers to provide education. If you know a business who might want to be involved, let me know and I can get them connected with the Workplace Wellness team. Every 3 years, hospitals are required to do a community health needs assessment. Hopefully you have seen ours in Hancock County and have filled one out. We've just finished our 2020 needs assessment, and so 3 years from now, you can look forward to the next one. So stay tuned. We look forward to hearing your feedback. The needs assessment helps to identify what the residents of Hancock County perceive to be the biggest problems and becomes part of our strategic plan, which is why Healthy365's focus is on these areas. For the past several years, we have focused our strategies around the 2014 and 2017 Community Health Needs Assessment, with the top 4 needs identified on this slide. General health behaviors are specifically referred to as the need for people to eat better and move more, so nutrition and physical activity. Drug and alcohol use, barriers to mental health and addiction treatment, tobacco and nicotine use. So Amanda Everidge will share later on in this presentation the results of our 2020 needs assessment. The ways in which we work to impact those needs identified are through prevention, education, support and intervention, and community engagement. It truly has to do with changing the culture of Hancock County. We are going to give examples of how we address each of these components.
So prevention is a critical step toward improving the health status of individuals and the community by developing healthy habits and coping skills early on in life. We have many programs that provide a foundation for developing healthy coping skills and for recognizing when one may need a little extra support to help them return to healthier habits. Here are a few examples of the programming we have done in prevention over the past several years and what they entail. Our KPR Institute Suicide Prevention Program, the Remedy Live program that we did in our high schools in the last couple of years, the 5210 Healthy Superstars program that's done in the schools, encouraging healthier eating, living, exercising, healthier choices. Rise Above It, our symposium that we have every year that focuses on mental health, addiction, and issues that affect us all in the community, and our tobacco and vaping prevention programs. Hancock County recently celebrated 10 years of one of the strongest smoke-free air laws in the state of Indiana. And as Amanda mentioned earlier, we spend countless hours in the schools and in the community talking to thousands of young people and community members in trying to help with prevention and treatment programs for them. Under education, so Healthy365 facilitates many education and training opportunities focused on improving health with various areas of focus. So much of the education provided is public, anyone can attend. While some of the classes are geared toward a specific demographic to provide specialized training opportunities, of course. So if you have any ideas for training opportunities at all or prevention programs, please list them in the chat box now or email them to healthy365@hancockregional.org. And a few of the examples we've done over the years, many of you may have attended some of these, are crisis intervention team training, mental health first aid, understanding human trafficking, nicotine and tobacco dependence in the behavioral health world, systems of care panel discussions, and navigating Medicare 101. But we want to hear from you, so let us know what you might be interested in the future.
The programs and initiatives listed here have the primary focus on connecting individuals to both formal and informal supports. They also serve as a connector for needed treatment. Support navigation, which you will hear about more in a bit, and congregational network navigation provides a more hands-on approach to support. This role is designed to walk alongside the needs of an individual and assist them in overcoming barriers along the way. Supports needed range from basic needs such as shelter, food, and clothing, to mental health, medical, and/or substance use treatment, and everywhere in between. The goal is to meet the needs the individuals have in the moment, understand their personal goals, and guide them down the appropriate path. Our goal is to reach as many people as possible in as many ways as possible, whether it is an event, tangible information we can share, or opportunities to engage and advocate for better health. We will remain engaged. Social engagement, networking, and collaboration is where we thrive. Together, we are changing the culture of health for Hancock County. With the help and support of our community, we are able to directly impact how individuals perceive the needs, challenges, barriers, and opportunities that our community has.
So if any of you are interested in more information on our teams, how to get involved, ideas on ways that we can look at moving forward, we definitely want to hear from you. Feel free to reach out. You can reach out to any of us directly, call the office, or send an email. Amanda Hinkle put the email address, like our general email address that is able to be checked in the chat box. So feel free to use that. So I'm going to take a moment to talk about our 2018 mental health needs assessment. Around 2018, it really brought a focus for Healthy365 to the topic of mental health and substance use treatment. We were at a time where our community was struggling with the opioid epidemic, and we are still working through that for sure. We were seeing increasing rates of suicide. Our Hancock County Jail was overcrowded at all-time high levels, and our schools were seeing increased drastic needs for mental health and substance use treatment services in our school locations. So similar to many other communities across our state, we had a lot of individuals turn to the local health system to understand what could be done to address these needs. And without hesitation, Hancock Health committed to hiring a consultant who is an expert in this area and helped us to understand what could be done and what we could do together to make it all happen. So our consultant was Suzanne Clifford, CEO of Inspiring Transformations. She led multiple stakeholder meetings over several months to complete a resource inventory, gap analysis, and to prioritize the identified needs. So together as a community, we came up with 17 identified needs and gaps within our community space. And collectively, we prioritized each of those just and ranked them in order. So I'll show you the top 4 here. We do have, if you're interested in seeing that full assessment from 2018, feel free to reach out to me if you've not seen that already. So the top identified was rapid access and connection to care, navigation, warm handoff, and connection to timely services. So really looking at how can we get individuals who are ready for support and treatment in a very reasonable amount of time and as quickly as possible, because when someone is ready, they're ready in that moment. And sometimes waiting 8 to 12 weeks just, well, it's not therapeutic and it's not an option. So, and then the navigation and warm handoff is really having an individual walk alongside us and someone through that service delivery system so that we're not getting lost in the cracks. We hear very often, that we lose people from one referral to another. And so how can we try to bridge that gap, and navigation is a component of that. Secondly, we had integrated school-based prevention, early intervention, and treatment services for students and their families. So again, looking at what can we do to reduce stigma, provide awareness, education, prevention, and then also provide that actual treatment. And not just treatment when we have a recognized need, but that early intervention. So really catching people as soon as changes start to happen so that we may be able to get them into the right level of care and support as quickly as possible. Shortened wait times and follow up after crisis assessment and treatment. Again, another area, those long wait times really prevent individuals from getting the much needed support that they need. So, and then lastly, prevention, early intervention, education and training, and then reduction of stigma. So Healthy365 system of care, and many of you on this call have really been working diligently to make changes in that space. And we have seen that really start to come together. So we appreciate all of the work that is done there. Throughout this process, one of the other additions that we had is not only were we looking to identify those needs, but working with our community partners to identify what areas could be impacted. It was not a process of what can Hancock Health do, but it was truly an opportunity for us as a community to figure out what we could do together to address this huge need. Because as Amanda mentioned earlier, it does take a village, and this is not something that can be done by any one organization on their own. So we started collecting that data, and we actually made a very big impact. Nearly every person that participated in that process committed either personally or organizationally to help fill in any gaps that were within their capacity. And that's really played out strongly. We've seen additions of new programming. We've seen enhanced capacity with staff, people doing more with more for the community, more to meet those needs without really being able to increase staffing in some cases. And we've also seen open dialogue and really looking at what can we do to improve the system together. And then how can we normalize discussions around mental health, mental illness, and substance use needs. So once we took this information internally here at Hancock Health, we worked to say, okay, we've asked our partners, what can you do? And we wanted to be able to provide a commitment on what we could do. So we worked for the next several months after this project completed to identify areas that Hancock Health had capacity for improvement. So I'm going to take a moment to talk about that. This process took around probably about 6 months to get fully underway, to look at all of the data that's out that we were able to access, analyze what do we really need, what are the spaces that we as a system can impact, what is our capacity, where are our strengths, and how can we do this in a way that we're not duplicating services, but truly complementing all the amazing things that our community partners are already doing or promising to do and working towards doing for our community. So I'm going to talk about that now. What you see here is Healthy365 and Hancock Counseling, the two components within Hancock Health that tend to work mostly on the mental health and substance use needs. So you see here currently in black the services that are already available and that had been working. Healthy365, the teams that mentioned, I'm not going to go into all of that because you just heard it all. And then Hancock Counseling providing individual treatment for mental health needs. Next, you can see in red the improved areas for enhancement. So you're going to notice some of the proposals going to be managed by Healthy365 and some is managed through Hancock Counseling. So Healthy365 taking the community components, community focused components, and Hancock Counseling really taking the clinical intervention piece, but together still strongly working as a true dyad system. Communicating regularly. We are right next door to their office, and our goal is to make sure that as a system, we're providing as much support as we can moving forward. With Healthy365, we're addressing a couple of key spaces on that needs assessment, navigation and care coordination being probably the most prominent, working to identify someone who can be that walk along. So for Healthy365, I want to take a moment to talk about what is a navigator to us. And we interpret it as someone that could not just connect individuals and provide referrals, but really know those referral systems, be aware of all services that are available. Someone that you can call that will listen to your story, assist in understanding what services are most appropriate, and then building those relationships with our community resources and our community partners to understand what and how they work. Each of you have an amazing niche, and in our organizations, our nonprofits, our services here in Hancock County have a specific space that is focused on for support. And our niche is to fully understand all of those other niches, to understand how organizations operate, who they serve, how they serve, and to really get to know the staff so that as we're working and walking alongside an individual, we are able to help them understand what they can expect coming forward and how that process works. So our initial plan was to have 2 navigators hired by the end of 2021. And however, due to the number of referrals we received, recognized need for services, and then, this fantastic experience that we're all walking through together, known as COVID-19 pandemic, has really brought on the need for extra help throughout our community. So we had both of our navigators hired by July of this year, and we actually reworked part of Laura Baker's job description to really focus her in the space of navigation much more broadly. So as we continue to move forward, we will also work with our schools to enhance support. And then I want to take a moment to talk about Hancock Counseling. The goal with Hancock Counseling is expanded therapy and to add and include substance use treatment, which is a new addition or will be a new addition to services at some time in our future. The goal is to expand with 10 therapists and a nurse practitioner. This is going to kind of address the idea and the plan of increasing capacity to serve more people and also reducing those wait times, as it is such a difficult thing for someone to have to wait. Medication assisted treatment for individuals who work with Hancock Counseling and are in need of that care and maybe aren't able to access that from other providers. And then virtual therapy. So as you know, like everybody, we're sitting here on a Zoom call. We usually do this in person, but thanks to where we are, we were able to, we were kind of forced into doing virtual therapy out of our mental health practices, all of our mental health providers and all of our organizations in Hancock County and across the state. So the important thing to know is that prior to COVID, there were legislative barriers that really prevented virtual therapy throughout Indiana. It limited reimbursement opportunities and really put a strain on some systems to be able to do this. So obviously that threat could potentially still be there, and we'll continue to support and advocate to ensure that we are able to provide this level of support to individuals moving forward. I'm glad that we were able to kind of jump in, and I guess if there is a silver lining to anything that's going on, is it really has, I think, forced all of us to be more adaptable and to really push, and not just Hancock, but all of you as well, to really push ourselves past our limits, past our comfort zones, to do more for our community, because every one of us here is here just for that. It's because we love our community, we love the people that are here, and we want to do the best that we can to support them. So Healthy365 started as an initiative, turned into a movement, and is now a recognized department of Hancock Regional Hospital with seven staff. In January of 2020, we opened the Connection Center, providing a physical location where individuals could come and could turn to for help and guidance. And we're really proud to take Healthy365 into the future with this component. So thank you for helping us make that possible. And I'm going to turn it over to Jessica to talk a little bit more about the Connection Center.
Healthy365 is a support system for our community. It's a safe and comfortable place for people to come and receive genuine help for life issues of any kind. A navigator will walk alongside you with whatever struggles life brings, even if there is no solution, but just to listen, encourage, and support you through your most difficult times. From January through November, the Connection Center received 782 referrals, and 629 of those were unduplicated unique referrals. 23% of those referrals had the primary identified need of mental health and substance use treatment. And many of those individuals had more than one need once we got to know the situation. The Connection Center is built on strong relationships. These relationships allow us to provide a true warm handoff and are critical to the success of those and who we serve. Of the 782 referrals we received over the last 11 months, we provided 1,197 referrals to community partners for needed services. I would like to share something we do each month. We call it our mission moment and highlights our mission and purpose for being here. Here is a mission moment from a wife and a mother. We call her Jay. She has a long history of mental health and substance use challenges. She has been clean for 4 years, but was struggling with high levels of anxiety, parenting and marriage difficulties. She attempted to seek help with 3 other organizations and were unsuccessful. She was directed to call Healthy365, and when she reached out to our navigator, she was almost to the point of crisis. Our navigator provided an empathetic ear and was able to assist her in getting a counseling appointment for the next day, and also able to help her to obtain insurance so she could start on her medication and get connected with a family doctor. Jay states, "I have been searching for help for the last 4 to 5 years. I've had overwhelming anxiety and did not know what to do. When I called Healthy365, I didn't feel brushed to the side due to my history. You took time to listen, understand, and help me figure out what to do." We recently asked her what navigation meant to her, and her response was, "In all honesty, Healthy365 helped me a lot. It goes so deep since the phone call. My marriage has started to get better because we almost didn't make it. I am better, more loving patient mother. I was just ready to walk out and give up. It has changed so much since someone finally just listened and I didn't have any image to uphold. It means so much that they have really stayed in touch to make sure everything is working out. And I'm just getting started, and it definitely is going to be a long road, but I'm glad someone finally took the time and didn't make me just feel stupid or crazy." There have been so many mission moments, more than you have time to sit and call us on. But I would like to, if you would bear with me, I'd like to share one of my own personal mission moments with a patient. And for confidentiality reasons, I'm going to call this patient M. So M is a single mom and is the sole provider for her home. M is new to the community, has no support system, and M's chronic pain led her to pain management, which then referred her to Healthy365. M has had a history of bipolar and depression, and due to many doctor's appointments, medications, and issues with her diagnoses, M quit going to therapy about a year ago and quit taking her mental health medication. This summer, M was told she would need a complete hip replacement, and due to the extensive amount of time it would take to recover and her lack of support, M was going to refuse the surgery. Em was told she would need 3 months of recovery and would be unable to work, walk, or drive, and this was very overwhelming for her. The first time I spoke with Em, I could tell just in her voice the worry and the fear she was feeling. She told me that she was only a few weeks away from surgery, and every therapist she had contacted had a wait list that extended out past her surgery date. Em felt that she was close to crisis and didn't know where to turn. Em was one of our very first applicants for our mental health and substance use scholarship, and due to Em's needs for an intense, higher level of therapeutic intervention, and with time and virtual being of high importance, it made for a narrow list of providers locally. Em was not able to use her insurance to cover the cost of treatment, so this made her unable to get the treatment she needed without the help of our scholarship. I was able to get Em an appointment with her virtual psychiatrist and therapist within 48 hours of her call. She was overjoyed to be able to get back on her medication and feel more stable before her surgery. And the day before her surgery, she stated to me that the uncontrollable feelings and thoughts had ceased and that she finally felt a sense of calmness and readiness for her surgery. While working with her, we categorized a list of things she would need to be able to have a worry-free recovery at home. We determined the need for food support. She would be unable to stand, walk, or drive for 3 months during her recovery. And even if she received delivered groceries, she would be unable to prepare them for her family. With the generosity of Meals on Wheels of Hancock County, we were able to work alongside them and get her and her children free delivered meals for the length of her recovery. She opened up about her daughter and how the divorce of her and her ex-husband and moving to Greenfield had been hard on her. So I was able to get her daughter in touch with one of our navigators, Laura, for extra support and help in finding a counselor as well. After Em's surgery, we often called for follow-up calls every other week, and she would end up calling in between just to talk. Em said that she was blowing her recovery out of the water. She was pushing herself to stand and walk and felt empowered to get back on her feet. She stated to me that she felt strong and able to fight through the pain to get better, whereas before she may have laid in bed the entire 90 days because she felt so depressed. And it has been 8 months now working together, and our last big goal to accomplish is getting her approved for disability. When I asked her how Healthy365 had impacted her life for the better, she stated, "I view you as a true friend, someone I can genuinely care about, that genuinely cares about my well-being, which is rare in my life. After so many times of going to the doctor and receiving worse news each time, I began to have thoughts of taking my own life. I love my daughter so much, and she was my reason for reaching out for help. I truly believe the moment I asked for help, that's when God stepped in and I met you. Since working with you and being able to get back into therapy, I've not had any more thoughts of suicide. I went from hopeless to hopeful, and it was given not only me a happier life, but also my daughter. I was able to get the help I asked for and the help I didn't even know I needed. Having the knowledge of the resources available to you and the knowledge of the resources that you need can be so complicating and extremely stressful for individuals, especially those that are already stressed and overwhelmed. Navigation's purpose is to have the knowledge, to be able to guide you to the appropriate resource and to help you utilize the resource successfully. But navigation would not be as effective if it didn't take the time to build relationships with all of you and everyone that walks through our door. We recently sent out a survey to the clients we have served and our community partners. And we asked, what is one word to describe Healthy365 staff and programming? This is the word cloud that represents those responses. And if you look at the larger highlighted words, they say helpful, friendly, needed, committed, knowledgeable, important, and caring, supportive, all of these words that stick out to people about the work we've done, and it reinforces us to do what we do. We are so grateful for the many responses and the love shown to us over the years, and we will continue to grow to meet the needs of the community. And I'm so glad that we have this heart to show the community what they all mean to us as well.
Thank you, Jessica, for sharing that with us. So now I'm going to line things up a bit. Are you able to find Watto on this slide? Thanks to coronavirus, he is now easy to find. However, he is missing his mask. Just like many of you listening today, we have been impacted quite significantly by the pandemic. We have tried to work through how we can remain engaged and be of support while also being safe. The onset of the pandemic came at our infancy with the Connection Center. Hancock Health was forced to shut down some service lines, therefore had many staff was available at our disposal. We coordinated with community partners to figure out other ways that we could rally behind the community to meet identified needs. We have been holding virtual meetings and/or trainings as much as possible. Many things have been canceled, including the Flat 50, some trainings, and our holiday social, which we look forward to sharing with you. We didn't get as many responses as we anticipated on the community health needs assessment, but we had a good sampling of our community. We tried to step in and provide support where we could and as needed over the past 9 months. We provided temporary transportation and food or meals deliveries for the first several months of the pandemic onset. We were proactive in reaching out to our community partners to stay current with their modified processes and understand areas of need. We were proactive in contacting thousands of Hancock Health patients to provide social support and a listening ear, as we all struggle with the challenges that COVID presented. In July, the COVID hotline moved into the Healthy365 Connection Center, where it currently remains. Healthy365 staff, with the tremendous support of 5 patient care liaisons from Hancock Physician Network, remain current on all that is COVID to help navigate individuals to the appropriate resource. This presented a unique opportunity, which we are most excited about. Our navigation services are more closely tied to our physician practices and can help individuals get reconnected with medical providers as needed. And we were also able to better help some individuals get connected for the first time.
All right, now that I'm unmuted, as we round out this, I'm just going to call it an eventful year. I'm really excited, and we're all looking forward to what's going to come. As always, we look to our community health needs assessment to drive our strategic planning. And mentioned earlier, we finished the 2020 community health needs assessment this year. So wanted to take a moment to look at that with you, to go over it. I'm not going to spend a lot of time on it. You will be able to find this assessment on our website at hancockregional.org. Happy to share it with you if you need that, and I'm sure we'll be sending out a link with the meeting update as this goes out. But the questionnaire was developed in mid-2019, that glorious pre-COVID era. Had we launched this later, we may have seen some slightly different changes, and it would be interesting, to see where that would lie on this graph. But regardless, we had a fairly good showing. We had a good sampling of our community, as Christy mentioned. And so what I've shown you here is the list of all of the identified needs, just in the order that they were most commonly responded to, and then the top priorities. So just to mention a couple, what we've seen, and this is the first time that we've seen this since 2014, is the cost of health insurance, healthcare, and/or medications jumped to the top health need. Addictions and drug overdoses, mental health, suicide, chronic diseases, obesity, tobacco, vaping, and the list continues to go on down. So just take a moment, if you can see this on your screen, hopefully it's large enough, to look at those. I know with the individuals, I was looking through the list of who's on this call today. I think there are folks on this call that address every area of these needs. And I'm very grateful for all that you do and look forward to doing what we can in the future. If there's anything that stands out, anything you want to point out, feel free to type it in the chat. If there's something you notice that you're like, oh, wow, I wouldn't have expected that, feel free to throw that in there now. And as mentioned, we will continue to utilize through Healthy365, continue to utilize the needs assessment in how we create our planning. So on our site, you will also then be able to find our implementation strategy. So the outcome or the plan for what Hancock Health as a whole plans to do to address these needs over the next 3 years. So here I just kind of put them in a larger format for you: cost of health insurance, addictions and drug overdoses, mental health and suicide, chronic diseases, and obesity. So while they're all very important, we can only focus on certain things so that we can do them as well as we can. And then we'll kind of look at some of the areas that we can address here as we move forward. While Hancock Health, or while Healthy365 specifically can't really do a whole lot to change the cost of health insurance, one of the recent additions that we do have, with our navigation, we will continue to help individuals try to access affordable health care, understand their insurance plans. We have Terry, our newest navigator, is a certified SHIP counselor, so we'll be able to support senior services in addressing the Medicare and Medicaid needs of the community. And then if you're not familiar, Hancock Health did recently open Gateway. I thought this was a great opportunity to just mention Gateway. And you've probably seen it out there at I-70, but if you don't know what they do necessarily out there, just want to point out that they do offer low-cost imaging and lab center. They also have an immediate care, and they're actually able to provide state-of-the-art imaging and that you would receive in the hospital, but at a fraction of the cost at our Gateway location. So Hancock Health is certainly trying to do all we can to provide excellent quality care at the most affordable cost to our patients, and to do what we can to help move the needs of our community forward. So we are going to remain focused on our journey and moving forward with you all and with all our new friends that we'll meet along the way. We'll continue engagement with our community partners, and not just within our teams, but ensuring that we're trying to facilitate collaboration with other coalitions, committees, and teams that are working to improve Hancock County as well. We'll continue engaging in things like the Hancock County Trails Plan, Community Night Out, Rise Above It, the Passport 5K. God willing, the Flat 50 is coming back in 2021. So we'll continue to also host some trainings and advocate for knowledge and skills sharing in spaces like QPR, mental health first aid, tobacco cessation. And then we're also really looking forward to some of our new adventures. We have a few things planned and some things that are coming up. So a couple of sneak peeks of thoughts that we've had and communications that we've had with our partners is that we are looking at really focusing on substance use support. And Jessica, who is now a certified peer recovery specialist, working to identify ways that we can incorporate peer recovery coaching into our community, and working to build opportunities to bring resiliency training, trauma-informed care, and really looking at best practices associated with that. Laura Baker recently is a certified mind-body facilitator and will be providing support groups that focus on building skills to assist in coping with just stressful situations, because we're kind of in a time where things are a bit crazy, and finding ways to enhance therapeutic and healthy coping are important. And we do have Terry, who is certified instructor in dementia-friendly training. So if you're not familiar with that, it's just an hour-long training that she can do to help recognize signs of dementia and opportunities to engage with individuals that you serve in moving forward. It would be fantastic. There are dementia-friendly designations that you can receive as an organization and that we can receive as a community. So good goals, because dementia impacts many, many people. So we're excited to have that specialty on board. We're working to evaluate hospital support groups and how we can bring those back safely with a bigger impact. We'll be hopefully offering down the road some virtual education opportunities. And then we're also going to look at modifying our meeting room so that we can do that in a better way. So hopefully, even when we get back to doing in-person things, we can offer in-person and virtual at the same time, which would be kind of cool. We're also looking to overhaul our website and ensure that it's packed with practical tools to help people be more mindful of their health and to find ways to connect with the community, the resources and needed information to walk along their path. We are getting our resource directory back. Yay. That is coming very soon. It's now going to be incorporated into our server system and reducing the risk of being hacked again. So if you weren't aware, we had an amazing directory. It was utilized by many people. And then we lost it, unfortunately. And so we are going to be getting that back here really soon. And then another piece is, as things change, processes changed over the past several years, we've been talking a lot about our identity as Healthy365. Now that we are a department of the hospital, it's important for us to have a visible tie back to Hancock Health while maintaining the integrity of a community-focused department. So you will likely be seeing a change to our logo. Nothing huge, we'll still be Healthy365, but just trying to incorporate and provide that feel a little bit to show that connection and to bring it all together as a nice, well-rounded department, much like you would see with like the Wellness Centers Gateway in some of any of our other practices. So look forward to that and getting input and feedback there. So please always let us know what you are thinking. If you have any thoughts, comments, questions, concerns, we will do our best to support our community where it's needed the most. We can't do any of this by ourselves. It is only through the grace and support of our community partners, our organization, our board of trustees, our foundations that really keep us going and allow us to do the amazing work that we do and to be a key component to our community. And that's all we really want. We're all here to just make this a better place to be for us, for our kids, for our future generations. So from the bottom of my heart, thank you for being part of this. Thank you for having a footprint, regardless of how big or small it is, with Healthy365, for walking along our journey, for maintaining communication and excitement and an open dialogue, sometimes having difficult conversations that we all need to have and need to hear, but taking it with grace and understanding, knowing that we're all in it for the same reasons. So feel free to reach out, let us know what we can do. We look forward to moving this forward. As noted earlier, our main email is healthy365@hancockregional.org, but you all have likely at least one of our emails because you got the link to the meeting today. So feel free to reach out to any of us. We'll get connected to the right people at the right time.